for joining me today at this virtual press conference. We're trying to do the right thing here and set the proper example. You'll note that people are trying to keep their social distance here on the stage. So once again, I'm here to update you on the Commonwealth's response to COVID-19, or the novel coronavirus. During the past week, we have been closely monitoring outbreaks and imposing mitigation efforts on a, as you know, county-by-county basis. So today I'm announcing that we'll be extending our mitigation efforts across the entire Commonwealth. This isn't a decision that I take lightly at all. It's one that I'm making because medical experts believe it is the only way we can prevent our hospitals from being overwhelmed by patients. This decision was made in conjunction with officials at all levels. Effective at midnight, all non-essential stores are to close in Pennsylvania, as well as bars and restaurants except for takeout. This also includes facilities and programs for seniors during the day. Essential services, including municipal services like trash collection, grocery stores, and medical facilities, are to remain open. At this time, I anticipate this to continue for 2 weeks, but we will be constantly reevaluating, and we will lift the mitigation efforts as soon as possible. We need to eliminate as many physical contacts as we can to prevent this further spread of the COVID-19, and we need to work together to do this, each and every one of us. Earlier today, New Jersey, New York, and Connecticut, and as you know earlier, Ohio, imposed similar restrictions all across their states. And I thank the residents of these states for joining Pennsylvania in working together to halt the spread of this disease. I also want to thank Allegheny County, Philadelphia City, and County for joining me in this effort. I know for all of us the next few weeks are going to be challenging. There's no reason to be fearful or to panic, however. But we need to take this disease seriously. So please, stay home. Make as few in-person contacts as you can. For example, if you need to go to the pharmacy, go to the pharmacy. To fill a prescription, just do that. But don't stop at several other stores or places on the way and make contact with a dozen other people. The fewer contacts you make, the less likely you are to get the disease, and the fewer people you're going to spread it to. And we all know someone who's susceptible that we don't want to spread COVID-19 to. Finally, we all have a loved one that we're worried about. Please take a few minutes to give them a call. While you shouldn't visit in person right now, I encourage everyone to call or video chat with your loved ones. Community is important right now because we're all going to have to work together to get through this. So please, stay calm, stay safe, stay home. We're going to get through this. We're going to continue to make daily updates as the situation progresses so that everyone stays informed, and I encourage everyone to follow the Department of Health's website and on Facebook and Twitter for the latest updates. Now I'm going to turn this over to the Secretary of Health, Dr. Rachel Levine. Dr. Levine.
Thank you, sir.
Thank you.
Good afternoon. Thank you for joining us for this latest update on the novel coronavirus, COVID-19. As of this morning, we have 76 Pennsylvanians who have tested positive for COVID-19. All are either in isolation at home or being treated in a hospital. A county breakdown of cases is available on our website at health.pa.gov. We are also getting reports of test results from commercial and hospital laboratories in addition to our state laboratory. As of this morning, 670 patients have been tested and are negative. I'd like to update you on new guidance that we issued over the weekend for Pennsylvanians and the healthcare providers regarding testing. If you are feeling mostly fine, or basically worried about your health, which I can understand, please stay home. If you do not have symptoms at this point, you do not need to be tested. If you are feeling sick but wouldn't usually go to the doctor under normal circumstances, please stay home and call your doctor from your home. Your doctor can discuss your condition with you and actually can order a test through a commercial laboratory or your healthcare system, and they actually do not have to contact through the Department of Health. These tests will be sent through commercial laboratories the way most other tests are sent. If you are feeling ill and you know someone who has been exposed and you have possibly been exposed to COVID-19, or you believe you have a medical emergency, then call 911 and seek medical care. Let the 911 operator know that you are experiencing symptoms that could be related to a COVID-19 exposure. Your healthcare provider can order tests through a commercial laboratory or through the state health laboratory. We also have received a lot of questions from parents who would like to know if their children can participate in playdates or sleepovers and other activities with other children while they're home from school. The simple answer is no, they should not. As a parent and a pediatrician, I can understand how challenging this social distancing can be for children and your families. However, the measures that Governor Wolf have announced today and the measures we have taken previously are designed to slow the spread of the virus and essentially flatten the curve without a peak of the virus and sick patients. Parents should encourage kids to play outside in their backyard, go for a walk as a family, ride a bike, and, as the governor mentioned, video chat with friends and grandparents. As the CDC said over the weekend, we should avoid gatherings of 50 people or more, whether indoors or outdoors. Pennsylvanians, including our children, have an important role to play in stopping the spread of COVID-19 and saving lives. Your job right now is to stay calm, stay safe, and please stay at home. As our Commonwealth moves forward through this, it is important to know that there are also mental health resources available. If you or someone you know is experiencing a mental health crisis, contact the crisis text line by texting PA to 741-741. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, the time it takes to sing happy birthday twice, or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. Try not to touch your face, especially after touching surfaces. Clean surfaces frequently. And if you are sick, you should stay home until you are feeling better. Practicing these everyday prevention methods can help slow the spread of infectious diseases like COVID-19. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. As the situation evolves, we will continually update Pennsylvanians through our website, our Facebook and Twitter accounts, our press releases, and our press conferences. And together, we will all work towards our vision of a healthy Pennsylvania for all. Thank you. Governor?
Now we'll take questions from questions I guess have already been offered. So,
Thank you. Yes, Governor.
Yes.
What retail, this is from Joy Norwood from the Jeffersonian Democrat. Mm-hmm. What retail directives, if any, are being discussed in the wake of the run on items such as hand sanitizers, toilet paper, etc., that have caused bare shelves at grocery stores in many areas where no COVID-19 cases have been seen?
Yeah, there has been guidance that has come out from the Department of Community and Economic Development, from private organizations like the State Chamber of Business and Industry, and I think the President, people at the federal levels. And let me just add to this. You know, there is no way that pharmacies or grocery stores are going to be closed. There is no reason to change your ordinary routine in terms of shopping. If you go once a week, continue to go once a week. and the supply chain will be able to sustain that. We need everybody to treat this not as a situation that deserves panic, but as a situation that just deserves attention, but living life as normally as we possibly can.
The next question, Secretary Levine, should people feel free to handle things like gas pumps, mail, or cash? This is Matt Heckel from ABC 27.
So for COVID-19 can live on surfaces. We don't know exactly how long it will stay and live on surfaces. We know about influenza, since influenza has been a yearly phenomenon for decades now. COVID-19, as we've been saying, is a novel coronavirus. I think that it is unlikely to be on something like cash, but I guess it's possible, or for the gas nozzles. So I guess if one wants to be really, really safe, then have wipes that you can use to wipe off the nozzle, and you can even wipe down cash. You don't want to make it too wet. That'd be a problem, but you could wipe it down. So I think it's a good point. I think we have to take as many precautions as possible.
Governor, this is from Allie Berube at ABC 27. 3 mid-state dirt tracks ran races as scheduled this weekend with thousands of fans in attendance. The promoters have said they will not cancel races unless forced to by the government. Will you force this business to cancel races? And what is your message to the fans who attended races this weekend?
Yeah, no, I'm not going to force them to cancel. This is something that, again, all of us, 12.8 million Pennsylvanians, are in this together. And we owe it to each other not to expose them to any symptoms that we might have, or to not expose ourselves or our family members. So people will be making their decisions on what they do with their lives all across the Commonwealth for the next days and weeks and months. What we ought to do is think not what should we do in terms of what the law is, what should we do in terms of what we owe to our fellow citizens. And that's what I would ask of the folks at the race course.
This one is for Secretary Levine from Sarah Paez from the Centre Daily Times. Are positive commercial tests for COVID-19 being reported to the Pennsylvania Department of Health immediately, or is there a lag time of a couple of days? Who reports those cases, the health system that ordered the testing or the commercial test facility? Mm-hmm.
So we are getting the results. We're getting the results the same day. And there's a regular system of how we would get positive lab results. It's put into our information technology system, and then we have the results. So it's a same-day reporting. It won't take several days.
From Michelle Gnazzi at the Daily American, will there be any restrictions on daycare facilities?
Again, we have closed schools all across Pennsylvania and recognize the challenges that parents have with children who need daycare when the parents are at work. On the other hand, I think all of us need to be concerned about the children, what they bring home, and also the child care workers. So at this point, we are calling for child care facilities to close. But again, we're not sending out the state police or the National Guard to enforce this, saying this is what they ought to do, and that's a public health issue.
Governor, this one is also for you from San Roland from the York Daily Record. What about casinos, movie theaters, gyms, and racetracks? Will all those be closed? Are they included in the closure announcements?
The casinos in the counties that we originally targeted were asked to close, and that will be true across the state. But again, that's part of the broader message here, which is let's limit the opportunities for people to gather together. We have limits on more than 250 all across the state. Again, this has to be self-enforced. This is not your government mandating anything. This is your fellow public servants telling you what the right way to handle this public health crisis is. We want people to be responsible. We all need to work together. We're all in this together.
Secretary, one is for you from J.D. Prose at the Beaver County Times. With the vast majority of Pennsylvania counties yet to report cases, what is your message to residents in those counties who are still hesitating to follow social distancing guidance and other recommended precautions?
So as we go at the end of last week and into this week, away from simple containment to mitigation, it is really important that everyone now, throughout the Commonwealth, as the governor said, practice social distancing. And that's why he's taking the measures that he's doing, asking businesses to close, the types of facilities you talked about, casinos, theaters, et cetera, to close throughout the Commonwealth. This has been stated many times this week in the media by Dr. Fauci, who's the head of infectious disease at the NIH, talking about the importance of the social distancing in these mitigation efforts and these closures throughout the United States. We were actually, the governor and I were on a phone call with the White House today and with other governors and other state health officials, and we heard from the President and Vice President Pence, and to quote Vice President Pence, active mitigation before there is sustained community spread is essential. So we are asking people to practice active mitigation, active social distancing before those counties have sustained community spread. And that's the best way that everyone can protect themselves in the Commonwealth during these difficult times associated with COVID-19.
Governor, this next question is for you. This is from Brett Schultes from WITF. Trump told governors not to wait for federal government to look for needed medical equipment on their own, respirators, ventilators, and other equipment. He told them on a call, according to a recording obtained by the New York Times. Is Pennsylvania on its own here in getting ventilators and other essential supplies? And what are you doing to make sure that we have that on hand?
We're doing everything we can. Obviously, there is a national demand for ventilators and respirators, and so we're not alone in looking for that equipment. We've done our own work in making sure we have stockpiled this kind of equipment. We're also going to be asking the federal government for additional help, and I can't speak to the extent to which they'll be able to respond. Obviously, the greater the demand, the more likely it is that we're going to run into some supply problems. So this is why these mitigation efforts are so important. But in the meantime, we are working hard to make sure we have the equipment we need, and we will continue to work with the federal government to make sure that we get what we need from them. Secretary, you want to add anything to that?
That would be complete, sir.
From Sam Rulin from the York Daily Record. In New York and New Jersey, they also encouraged that travel be restricted from 8 p.m. to 5 a.m. Is PA also doing that?
That sort of curfew, no. I spoke with Governor Murphy of New Jersey. I would like people to stay home 24 hours a day, not just between the hours of 5 and 5, some sort of a curfew. And so I mentioned that to the governor, and he was in full agreement with that. I think we're all trying to do the same thing, slightly different ways of doing it, but basically all of us want to make sure that people are not interacting with people.
Secretary Levine, we've had several outlets asking about how many people have been tested at this point in the Commonwealth and how many are under investigation.
As of this morning, 670 patients have tested negative, and we reported that there are 76 Pennsylvanians who tested positive. So you can do the math in terms of how many people have been tested. Again, though, we're getting tests. We're doing our own tests at the Pennsylvania Department of Health Laboratory in Exton, and then many tests now are being done by commercial laboratories and now laboratories at health systems. So that is going to be continuing to expand.
Governor, from Ann Shannon at WGAL, are you considering using the Pennsylvania National Guard to help in mitigation efforts?
No.
And from Sam Rulin from the York Daily Record, does this closure apply to PennDOT?
We're working with PennDOT, actually all state workers, to determine who's essential, who's not essential, and there are parts of PennDOT that are essential, and they will continue to work. Obviously, if we have a snowstorm, We will want people to be out in the roads, clearing the roads of snow, but we'll work within PennDOT to make sure that those who are not essential workers are given the opportunity to work from home or stay home.
Secretary Levine, we're getting several questions about community spread. Can you say specifically that there is no community spread in Montgomery County, or is there community spread anywhere else in Pennsylvania?
Mm-hmm. So when we talk about community spread, that means that there are patients who have contracted COVID-19, and we don't know how they did that. We don't know that they were in contact with someone that is a known positive or a specific travel history. So there are a very few number of cases where, despite very active investigation of ourselves and other health departments, that we have not been able to find a specific contact. And so there is a presumption that those very few patients, it's one or two, have had community spread. In this, what the CDC is talking about when there is even more concern is what they call sustained community spread, and that means it's much more extensive in an area. We have not reached that threshold of sustained community spread in any area. But that doesn't mean we won't, and actually we fully expect that we will see sustained community spread. And as the Vice President said, we want to have very active mitigation efforts before we have sustained community spread.
Governor, we have some questions about upcoming elections in terms of what impact this will have on the 2020 primary, and then in terms of the special election tomorrow, what does it mean for facilities expected to host voting?
Yeah, it's a good question. I'm not sure what impact it's going to have on the primary. Obviously, we want to keep people safe, so to the extent that the state needs to move the April 28th date to another date, other states have already done this. Pennsylvania is certainly taking that into consideration. There are special elections coming up tomorrow, and the Speaker has decided not to move those elections, as I understand it.
Before we go to the next question, excuse me, sir. So I'd like to ask actually Dr. Watkins, who will have a few words about the community spread. Thanks.
Thank you. As cases increase in Montgomery County and in the collar counties, and case reports come in from private and commercial laboratories, it gets more and more difficult for public health to investigate and fully understand what all the risk factors. So as Dr. Levine said, at this time, although we are aware of some cases in that area where we really can't figure out what the risk factors are, that is likely to increase in the next few days, and we will be talking with Montgomery County about whether community spread is considered ongoing.
We have a question for Governor Wolf. The Small Business Administration has announced disaster assistance loans for small businesses. What step has Pennsylvania taken to secure funding for Pennsylvania businesses? And is the state considering providing any emergency relief funding from state funds to the restaurant and service industries? This is from Lizzie Hartson at Capital Star.
Yeah, two things. We are working with the Small Business Administration to make sure that Pennsylvania gets its share of the Small Business Administration loans promised by the President in one of his press conferences. In addition to that, there are some funds that we can free up here at the state level, and we actually had a good conversation with legislative leaders earlier today to talk about what we might do to free up those funds. The first step is this Wednesday working with the Capital Financing Authority to actually make those funds available, and we will continue to pursue those things at the state level. But the big source of funding, I think, is really the federal government, and they have already made that money available, and we've already been in touch with them through the Department of Community and Economic Development.
This one is for either Governor Wolf or Secretary Levine. What about state parks? Can you take your family for a hike at a state park, or is that discouraged? That's Andrea Rose from the Record Herald.
Well, the state parks will remain open, but again, I have a concern about the employees, the state employees who work in those state parks, and we want to keep them safe. And I think the same idea that applies across the state to every interaction of our citizens, we want to make sure people are safe. So I would suggest that caution is as applicable there as in any other social setting.
I don't have anything to add, Dr. Watkins.
Be careful. We're all in this together, and every decision we make that leads us to touch another human being, be close to another human being, is going to be something that could have consequences we don't want.
And then a follow-up question related to PennDOT about driver license centers. Would they also be closed? This is the York Daily Record.
Yeah, that we are in certain areas we have closed them down again to protect our employees, people working at the state level. But I don't think we've made any hard and fast decision across the board on the license centers or the real ID centers. And I'm not sure if the federal government has decided at this point to move back the date, which is October of this year, as to when real ID has to be in place. They may relax that. At this point, they have not.
Dr. Levine, we have a question from Fox 43. We've received some confusion over who can be tested. People are saying they have symptoms but are being turned away for tests because they haven't traveled internationally or have direct known contact with someone with COVID-19. What should people do if they are experiencing symptoms but haven't traveled abroad or have a known direct contact?
Sure. I'm going to ask Dr. Watkins to provide that answer. Thank you.
Sure. So yesterday we put out a health advisory notice to providers to address one of those, to address that concern. So if you have mild symptoms, stay at home. If you feel worse, contact your health care provider. If you have severe symptoms, such as a fever over 100, shortness of breath or cough, call your health care provider. This is how we're determining if a patient should be tested. If you, as a provider, can get testing ordered for your patient if you feel you need to, through Quest or LabCorp or through those hospital facilities that are currently providing testing. However, if the patient is a contact of a confirmed case and is sick, if the patient resides in a congregate care setting and is sick, if the patient is a health care worker and is sick, or if the patient is hospitalized with relevant symptoms and no alternative diagnosis, please call us and we will arrange testing through the Bureau of Laboratories.
I think that what I would like to add to that is we're trying to shift the testing of patients with relatively mild symptoms that a healthcare provider feels might have COVID-19, so that the healthcare provider do that through the commercial laboratories and through the health systems. And I think that over time, most of those patients will be tested in that way. So the healthcare provider should be able to obtain the specimen and send it to Quest or LabCorp the way they send many tests through their office or through hospitals.
We're going to take one more question and then follow up with the rest of the questions that we've received after this press conference through the Department of Health and through the governor's office. This is to Dr. Levine and Governor Wolf from Sean Hamill at the Pittsburgh Post-Gazette. UPMC said on Saturday they would have created their own in-house test earlier than they did, but the CDC and FDA said that the state and federal health agencies would take care of that. Was that a mistake to discourage clinical or commercial labs from creating their own testing ability from the beginning?
I was not aware that the CDC made that directive. Maybe you can comment on that.
So I think that there had been, so again, the natural history of the testing is that all the testing until for a month or more was done at the CDC. It was only approximately 2 weeks ago that testing was started at our laboratory, and we have been ramping that up. But at the same time, commercial laboratories started testing, and the CDC, the federal government and the state have been encouraging academic health centers to do the testing. So I'm looking at Dr. Watkins. We have had no discouragement of academic centers developing the testing, and we encourage academic centers to do that.
No, we welcome it. I think the testing was just rolled out in a prioritized manner from CDC.
Thank you all. For all reporters who have submitted questions electronically, we will follow up on each question we received, either from the Department of Health's press office or from the Governor's press office. Thank you so much.